Hello, my name is Brenda Vossler. I'm the Binax project leader with the North Dakota Department of Health. The purpose of the Binax screening program is to minimize or mitigate the impact of COVID-19. The goal of making this screening program available to businesses is to keep employees on the job while decreasing the risk of infection. Coupled with the mitigation efforts of masking, distancing when possible, good hand washing, and cleaning of the environment, regular screening of your asymptomatic workforce allows you to identify any asymptomatic positive cases and move them into isolation and out of the work environment very quickly. Slide. The BinaxNow COVID-19 antigen test is very fast, reliable, simple, and portable. So when I say fast, this test provides results within 15 minutes. It's reliable. If the Binax test is positive, 99% will also test positive with PCR testing. And it identifies almost half of the positive asymptomatic people that a PCR test does. But PCR tests take 3 to 5 days to get results back. And meanwhile, those individuals are spreading the virus. Keeping in mind that no lab test is perfect, it's believed that those asymptomatic positives that are not identified by Binax are likely those with low viral load and least likely to be contagious. In addition, testing at regular intervals of weekly or twice weekly will increase the possibility of catching positive cases as they develop enough viral load to be contagious. Getting even some asymptomatic positives isolated early will have a significant impact in slowing the spread of this disease. It's simple to do. The swab is from the lower nostrils, not the deep nasal pharyngeal swab that some have already experienced with PCR testing. And other than a little tickling or attempt to sneeze, this should be painless and no discomfort. And it's portable. There's no machines needed. The credit card sized test and a swab and a dropper bottle of reagent is all that's needed. Next slide, please. So you have an opportunity to take advantage of Binax screening in your work location. I need to emphasize that this program does not include screening of symptomatic employees or someone who's in quarantine and wants to get out at the earlier 10-day mark. Symptomatic staff and those that are in quarantine should not be at work and should seek testing and treatment from their medical provider or through a community or public health testing event. Next slide. The concept is that employees are trained to self-administer the Binax screening test in a monitored environment. A team of designated employees or volunteers is trained to conduct the screening event, and at least one person with a medical background is recommended to lead the screening team. All employees are trained to self-conduct the Binax test. Asymptomatic employees engage in serial screening on a frequency of at least weekly or more often at the discretion of the business. The state provides access to video training materials and training support, as well as access to the software needed to register employees and report test results. And the state has an adequate supply of Binax test kits and provides those to you at no cost. Next, please. If your business is interested in pursuing this mitigation option, the state will provide a liaison to work with your point of contact to complete a checklist of eligibility requirements. And that includes the identification of volunteers needed to form the screening event team, ensuring that all employees and the event team are properly trained in the process, acquiring access to software licenses, also at no cost to you, and finding the appropriate location to safely conduct the screening, assuring a plan for management of regulated biohazard waste, and assuring access to order the Binax test kits from the Department of Health warehouse. Next, please. The test results, both positive and negative, are required to be reported to the Department of Health. Anyone who tests positive must be removed from the work environment immediately and will be contacted by a case manager from the North Dakota Division of Disease Control to assure that the individual understands the isolation requirements and has an opportunity to ask questions. Next slide. The benefits to your business include the flexibility to determine your schedule for screening events. Screening events are scheduled right at the workplace at a day and time that best fits into your business model. Quick results identifying positive cases and getting into isolation decreases the number of healthy employees that are exposed and ultimately limits the spread of the virus through your workforce. And as stated previously, it's a simple process after that initial investment of training after the investment of the training, the screening process is easily sustainable. Next, please. Each business must be approved for a CLIA waiver. CLIA is Clinical Laboratory Information Act. This is a federal law. The application is made through the North Dakota Department of Health, and there is a fee of $185. So the assigned liaison and the Department of Health staff are available to assist with the application process. And also, if you are a corporate business with multiple locations or part of a professional organization or association that is willing to take on that CLIA license, there's such a thing as a multi-state CLIA waiver, or a multi-site CLIA waiver, so that you can have one CLIA waiver that covers multiple locations within your business community. There are no concerns about HIPAA or non-disclosure agreements because your data entry staff don't have access to any medical information beyond the screening test results that they're entering into the system. Very little PPE is needed in this model. Basically regular masks for all that are in the screening area and plastic gloves available from many local retailers. The PPE and supplies other than the test kits will be the responsibility of the business to acquire or purchase and are not distributed from the state medical cash. Next, please. Your users will be licensed by the state for access and use of Microsoft Dynamics software. You'll be responsible to provide at least one iPad and maybe more depending on the number of employees that you will be screening at any given time. And that is necessary to register and report the test results. And there's also no cost for the licenses. The cost of acquisition of iPads, if it's necessary, would be yours. Next, please. So we're asking for a commitment of the business and the staff to screen on at least a weekly basis. The repetitive nature of the screening is important to effectively identify asymptomatic new cases early. There must be a method for proper disposal of the biohazard waste. The test cards may contain viral material from any positive cases identified and thus must be disposed of properly. And the gloves needed should be easily acquired from a local farm and home store, Walmart, Menards, something like that. And I just want to comment again on the biohazard waste process that the liaison from the state will be happy to help you identify potential vendors or partners in the community that might be able to provide that service for you. Let's go to the next slide, please. So the state will also provide either on-site or virtual train-the-trainer support and technical assistance as needed. The state liaison for businesses that opt to participate is Al Hansen, and his contact information should be made available to you through other communications. Next, please. When a business indicates an interest or a desire to participate, Al will work with you to assure that you get you operational so that you can conduct the weekly BinaxNow screening at your location. And the training that all employees must complete is available by video, and it's about 10 to 13 minutes. And then the staff that will be doing the data entry will have an additional video to watch that's about 12 minutes. Next, please. So the state train-the-trainer team will provide direction on the setup of the location and the flow of the screening event. And on the next slide, we're going to take a look at what that screening event looks like. So next slide, please. Prior to the scheduled screening event, the screening team leader, this is that medical volunteer if possible, will complete the test controls for each BinaxNow test kit needed for the event. There are 40 tests in each kit, and the control process gives the tester practice and confirms the viability of the tests within that kit by running sample tests, one of which should result positive and one should result negative. The employees will pre-register one time only at testreg.nd.gov. If they've attended any COVID testing event previously, they're already in the system. And then a staff person will identify the employee in the TestReg database, confirming by birth date, and scan the QR code on the test card. And that links the individual to that specific test. Then the chemical reagent is added to the card. The employee then enters an isolated swabbing room, closes the door, removes their mask, and swabs both nostrils for 5 seconds each, rotating around to get a good sample. The swab is then inserted into the test card and rotated 3 times on the card. The card is closed and sealed in a plastic bag, and then the time is noted on the card. Hands are sanitized, face mask is put back on, and the employee then exits the swabbing room and takes their test card where it is timed and read. Results are then entered into the data system, and the employee picks up the fact sheet, exits the screening area to await test results, which they will receive via email or text in about 15 minutes. Of course, following the test event, the swabbing room and the area surrounding should be cleaned and disinfected thoroughly. Our next slide, please. We estimate that a screening team of 3 to 5 people would be able to complete 30 tests per hour, and we think that with experience that rate will increase. And there's some flexibility there in terms of combining some of the steps here. So your data person that is registering people and scanning the QR code initially could also be the one that's applying the reagent to the card. Just depends on the size of your organization, the number of people that are screening at any given time, and what you have available as far as resources to manage the screening site. Next slide, please. Supplies and equipment requirements are minimal. You will need to have reliable Wi-Fi in the screening location or Verizon service on the iPad. And then it's cleaning supplies like hand sanitizer, disinfectant, and office supplies such as pens and markers and tables and chairs. And also the Ziploc bags to put the specimens into, and the minimum size on that is 8.5 inches by 3.5 inches. So what are the next steps? Local chambers of commerce will be reaching out to all member businesses with at least 100 employees to request that they respond to a short survey indicating whether or not they would be interested in participating in this screening program. Interested businesses will then work with their state liaison to complete the eligibility checklist and schedule the first screening event. Business leaders will communicate the opportunity and expectations to their staff to conduct pre-event training and conduct the first event with train the trainer support, and then proceed to schedule weekly screening and reporting. Thank you for your consideration of Binax screening in your business. Remember that whether you add screening to your mitigation efforts or not, we encourage you to continue masking, maintaining distance, and washing your hands. You can make a difference. This concludes our program today. Thank you for listening.